obviously one of the key goals here is connecting people with family doctors, but I'm wondering for those British Columbians who do already have a family doctor, what sort of real changes, if any, will they notice once this new payment model comes into effect?
Thank you, April, for that question. I think an immediate sigh of relief, which I'm hearing from many of my colleagues who just are watching probably this briefing this morning and also may have received my president's letter that went out this morning from Doctors of BC. I've been hearing already, and I think the moral distress that when we speak of and the burdens and the administrative tasks that in a day that you're inundated with lab results or diagnostic reports or that pull you away from your patient encounters, and for all those physicians that have needed to be compensated for the time because maybe it takes longer or they work at a different pace than some of my other colleagues. I know I was one of them. And to be able to be compensated for a block of time and to be able to take that time with your patient if need be, as well as seeing them with their complexities and really getting time and building space for even your clinical teaching without having to take another break or allowing the capacity to change. So really a renewed sense of hope and optimism that a lot of family doctors have been facing, and addressing the overhead and the rising costs of business is a major one in this new payment model. And also another way of allowing our family doctors to know that we've been listening. We did some robust engagement early summer, and we've been doing that through our divisions of family practice across the province for many years. And I feel that finally they have been heard, and we've listened carefully and co-created this model with a lot of significant input from the physicians on the ground. They've been telling us what they need to be able to serve their patients better, and I truly believe that this is the way forward. I think that when we think about primary care and healthcare systems and what we need to build in the 21st century in this province to be evidence, to be able to be a reputable healthcare system that provides the needs for all of our patients, this is the first step. And I really am truly excited embarking on this journey because I truly think that our patients will see a little bit more livelihood and a breathing room with the commitment to locum coverage for our physicians that have never been able to take time off or step away from their office because of the needs and the demands on them. This will enable them to have a healthier working environment, and that's all we can hope for, is to create better working environments and conditions that foster better care for our patients, because we know healthier physicians and doctors make healthier patients, and this is the way that we need to be working.